A very good day, my dear undergraduate and postgraduate students, as well as my junior colleagues. This particular class is not restricted to pathology, and it is a problem that has been plaguing us. As undergraduates, we might get questions like this, sometimes even postgraduates. The postgraduates will also be asked questions on problem-based learning when they come to the final exam. There is a topic on pedagogy. And the junior faculty, you will be sitting and correcting the papers. So this is a kind of an eye-opener for us. And I had been a core member in the medical education unit for more than 25 years. So this would suffice. You are one of the examiners, or rather one of the 4 examiners. And what do you see? Normally you find that in the assessment, when there are 4 different people, there can be some disparity. So what are you people seeing in this? I'm giving you time. So perhaps you would have noted, and look at it carefully again, you will be noticing something else also. So this is a typical example of an optical illusion, a psychology with which something is being perceived. The worst distance between 2 people is misunderstanding. So the same concept is there, and we tend to misunderstand more than understand. Once again, a very superb picture that I had taken from McLeod, clinical medicine, when I was an undergraduate student. It now happens to be shown everywhere. On the picture, you see a young lady or an old woman. Now, coming to the problem-based, the case. A 45-year-old male from Europe was on a tour to India. India is a tropical country, we should remember. He developed a short bout of vomiting and diarrhea, which was self-limiting. So obviously, he was enjoying his tour, and courtesy dreamstime.com. Superb pictures these people do. Kindly go back to them for any of your preparations. His hemoglobin was 7.5 grams, and these were the electrolyte values, and the vital signs were given. The pulse rate is slightly increased, and the BP is almost normal. Tachypnea, you are better to interpret than me. And serum bilirubin was 0.8. Now, it is easier to ask questions than to answer them in an understandable form. So, pathetic student and then the commanding or demanding examiner. 2 weeks later, he had a recurrence of the same features. There was vomiting, there was some diarrhea. What can be your differential diagnosis? Again, courtesy Alan me. Obviously, the person is sick. What should be the baseline investigations? And in the meantime, Vidal and cholera were found out to be negative. What should be your immediate line of treatment? So look at the way the problem ascends. There is a clinical one, there is a treatment, and then there is an interpretation of the laboratories. And what will happen is we might be given a plethora of reports. Some might be pertinent to that case, some might not be. What I am showing you is problem-based learning. This is how it should go. It is not detecting an answer and writing something about it. A problem is given, the students runs around, refers, asks, again comes back with some finding to the guide or the faculty. He is given some more clues, for example, the laboratory values or even a laboratory report. He is supposed to interpret what are the findings in that. This is not to scale for that particular case. Thanks to Smart Pathology Lab for the format. So again he goes back and there are one more list of laboratory reports. So how does he interpret all of them? There has to be a cumulative one. So an initiative and then a reference, again a repeated reference. The idea is you are building up the problem, giving the student some kind of a clue and making him give the diagnosis. The learning goes on. Meanwhile, there is a mild loss of weight. What further investigations can be done? In the motion, for example. Obviously, weight loss, you people will be knowing what to do. There was a collective decrease in the nutrients. Probably they have done some serum values. What tests can be done? And since it is a gastrointestinal tract, what can you expect in a biopsy? So loss of weight, what are all the differential diagnoses? Again, this is not a question for you to answer in the exam. You are developing a problem, studying it, and developing your knowledge. This is problem-based learning, and it has been misunderstood and misconstrued throughout, and we are just charging the students with problems. The progress. Meantime, there was a symptomatic recovery and he was taken to his home country by his relatives. After 2 months, there was a communication and report, and the photos showed that he was hale and healthy. Obviously, is quite good. Fine. This is a discharge. And finally, obviously, a very happy man with his family. Let us imagine that he is the patient. You find that in an educative system, there are various steps with which we can progressively teach and learn. And we are pushing the huge burden of education. At the same time, there can be enough amount of hindrances. A wonderful cartoon that I had picked up. As a summary, you find that it is a disease of unknown origin. Panel of investigations have been done. The normal values, integration, interpretation, histopathology, DD, line of management, what can be the adverse effects of the drugs, further line of management, what facilities will be available in a tertiary care, the consultants to be consulted, communicative skill, handling of a foreign patient. This is more of forensic importance or community medicine, and it cuts across almost a lot of subjects, and so on it will go on. So it is a process of learning. This is problem-based learning. So the general guidelines for PBL is the faculty should be a facilitator, student should do a search on it, reassurance should be given to him constantly, more references needed, and finally the student should come with a short list and probable diagnosis and treatment should be suggested. Now, this is not a PBL. So 50-year-old male was brought with sweating, palpitation, reduced BP. He was a diabetic, etc. And what are the questions over here? They are directly given. Diagnosis, gross, microscopy, lab findings, etc. This is a typical question from the MGR Medical University in Tamil Nadu. You find it. And it is from MBBS pathology. So this is one. Now this is not a PBL, and then what it is? This is a problem-based question. I totally disagree with such questions being given in the exam as well as more so in the entrance exam because they are very short, too little time is given, it is analytical, The frequency varies from the other questions and so on. Only if the examiners try to answer, they will be knowing the problem. So the time is too short, boils down to mostly recall that particular last question. The student might guess the answer and sometimes it can be wrong. Ambiguity can be present. So it has happened in many universities. I'll come to it at a later date. The extent of the answer is also vast and time management is also difficult. So about the problem-based question, we shall be continuing sequentially. The conclusion is this. So somebody tries to progress it, somebody tries to hinder it, and that is medical education. Find out the language.